माय मोगाचो येवकार. सगळे आमचे CCR TV पळयणाऱ्यांक a warm welcome. This welcome is for our special program Tumchi Bolaiki, Tumchea Hatant. Your health in your hands. Today is a special episode and we'll cover something different from what we have been presenting to you. We have a super specialist having done his training in a super specialty after his MBBS and MD in internal medicine from the Goa Medical College. He moved on to Bhubaneswar in Orissa, where he did his DM in clinical hematology. He has super specialty training in a clinical hematology in AIIMS in Bhubaneswar, Orissa. At the moment, he is a consultant hematology and BMT physician and available at Wisdom Super Specialty Hospital in Panjim and at Manipal Hospital in Donapal. Earlier, he was a consultant hematology and bone marrow transplant in New Delhi, has published several articles at the national and international level, and also research publications, and is a highly trained healthcare provider. Welcome, Dr. Nakul Dilip Tikare. Welcome, Dr. Nakul. And our regular moderator, former head of the pathology department of the Goa Medical College, ex-head of the Goa Medical College's blood bank, former dean of the Goa University, and presently a very active researcher with the Asian Society of Cytopathology and Histopathology. Welcome, Dr. Wiseman Roque Pinto,
Thank you.
also from Goa, from Asolna.
Obrigado.
Yeah,
Obrigado.
always welcome. For all of us, this topic concerns the study of blood and blood disorders. Is bone marrow, lymphatic system, and it is concerning the study, diagnosis, treatment of blood and blood-related disorders. So, Dr. Nakul will focus on diagnosis and treating disorders affecting RBC, and you get problems like anemia, then WBC, problems like leukemia, then the platelets, bleeding, clotting disorders, and overall blood disorders. So, he is a specialist who manages everything from relatively common problems like anemia, as I said, to complex cancers of blood and immune system. The cancer of the blood is on the rise in Goa, all over India and the world. Anemia also is common. And Dr. Nakul will share with us the common bleeding disorders symptoms and what happened even in a nose bleeding cases. Over to Dr.
I think
Nakul.
Dr. Nakul and Senior
And Dr.
Jovito
Wiseman.
will start with the hematology routine. Like, what are the symptoms the patients come, what are the laboratory tests you do, and we'll do RBC, WBC, platelet. Then we'll go for the bleeding later on.
Yes.
Senior Jovito
Yeah.
and Dr. Nakul. So the floor is yours now to explain to the people and to us.
Hematology mainly concerns with blood related disorders. There are different ways that it can present. Now once we say the commonest one is like anemia, that is low hemoglobin. Now low hemoglobin, different age groups present with different reasons. In the kids, it is mainly nutritional because of iron deficiency or B12 vitamin deficiencies. In young women, it is mainly because of the blood loss during excessive menses, or sometimes iron deficiency in the rural part because of poor nutritional status. Adults, iron deficiency is one of the cause, but mainly we have to rule out some bleeding ulcers in the stomach or in the intestine to rule out some blood loss from there, and which may cause low hemoglobin. In elderly, it is little more complex. It can be production defect of the hemoglobin, which can cause anemia, or it can be some blood losses mainly because of ulcers, or sometimes more grievous problems like cancers, which can cause bleeding.
Correct. So that's about the anemias you spoke about. Now, besides this, Dr. Nakul, some people who have a particular type of a diet, they also, very vegetarian or very vegan. So they can also get, so you can just elaborate on this. Because a lot of our viewers today follow a vegetarian, vegan, many.
Yeah.
Mostly.
And the problem,
In
Dr. Wiseman,
Yeah.
when you talk of veg,
Yeah.
B12.
B12. That's that's what I'm. B12. So megaloblastic, Dr. Tikare.
So in vegetarian people, the main culprit is B12 deficiency. When there is a vitamin B12 deficiency, it presents with anemia. It has a particular way we look at when we look at CBC. Sir might be knowing there are some parameters which we look into, and we come to know that this might be B12 deficiency.
So actually, the message for the people to be those who are vegetarians and those how to avoid it, means how to
basically B12 is present in animal sources mainly. Now in vegetarians, when we want to search for B12, it is mainly through raw salads which are cooked well. They have those small microorganisms which can process B12 and provide that B12 to the patients or to the people. And mainly curd based or milk based diet has high amount of B12. So the ones who are having curd or paneer or butter, they have the B12s in the food, and the incidence of B12 deficiency is less in among them.
In your practice, Dr. Tikare, you were in MD medicine. You have done medicine first. Then you have done. You have gone to AIIMS Bhubaneswar and done DM, hematology, super specialty. Then you worked in different hospitals. What are the common anemias you see in India? In your practice?
Most commonly I come across is iron deficiency anemia, and among the vegetarians, like you said, is B12 deficiency.
The diet of the people is not very good. Dietary diet. You give talks on nutrition, diet. I know you're expert in this. He knows the rare elements. So somehow the diet in India is not very, I'll say, nutritive, healthy, doesn't have micronutrients. Followed. It is a standard. So I would like you to. So nutritional is important.
Nutrition is important.
Yeah.
Main thing for iron deficiency is like we have to have little bit of green leafy
vegetables.
Lots of green leafy vegetables we have to incorporate.
Incorporate.
Many of the people, when they say vegetarian, when we say vegetarians, iron deficiency, they just have dal and rice.
Correct.
That is not going to have any iron.
Eggs also is a good source.
Eggs is good source.
I ask my patient, they say, Doctor, I'm very vegetarian. I'm pure vegetarian. I don't have even
Why
eggs.
in places now in West Bengal they have removed eggs from the schools.
They've removed eggs
to make it a vegetarian.
So
that
is something that we should not be this.
Should not.
But are there vegetarian eggs?
See, actually, what happened? Vegetarian, non-vegetarian, whatever it is. There are factors and there is a choice of the
choice.
We do not go into to change the choice of the it is a choice from due to various reasons. So that is it. We don't interfere in that, but we try to tell the people that with, as you rightly told, how to get the B12, how to get the
because there are other sources.
Like you said, paneer and
paneer. That is for B12. For among vegetarians, if you go to see in iron-rich diet, one is green leafy vegetables. There is something called as ragi, nachne. That is also rich in iron.
That is also rich in iron.
Soya beans. They are also rich in iron. So all those.
So these things the people should consume.
Actually, in Goa, ragi and nachni.
As a child,
it was it was very common in my childhood also.
Your childhood also. Your childhood was in Goa.
Yeah.
So Nashne was, though you didn't like it, you had to have it in the evening.
But you must know how to prepare.
You must know how to prepare.
Yeah.
Tastes are variable. So,
Tastes are variable, but it's one of the richest source.
Richest source.
Yeah.
And in the old days, it was very popular.
It is important.
It is important. This is important.
Iron is very important.
Iron is
especially for girls, for ladies,
for everybody,
all them all.
for girls, for ladies, because of their
And
menstruation.
especially also in heart patients.
In
Yes.
heart patients.
In heart patients, iron is known to improve the heart functions.
Heart
also.
function. Yes.
Yeah.
So same will be for strokes also.
Yes.
Yeah. Now see, basically, the iron is important because not only for hemoglobin, but it's required for the enzymes and the cells and
Many other pathways.
many
are
other
in-
parts of this. So that is it. So, but I see that nutrition is defective. I won't say defective, is insufficient
Taking
in
a back
our
seat,
India.
yeah.
Young people going for fast foods, preserved foods. Which is unhealthy.
Yeah,
Correct.
fast foods, preserved foods. Also, one important thing is because of I think heavy lifestyle workload and all,
Workload, yeah.
they have this acidity
Chips,
and they
yeah.
keep on taking antacids.
Antacids.
That also prevents absorption.
This
of
is
iron.
very common in Goa.
Very common.
Gas problem,
हाँ,
acidity,
Acidity
and then
and
they
take
say
antacid.
Jalusil,
Yeah.
nothing. Digin, Jalusil.
They do not consult a doctor. They take this. But this should be looked into.
This should
So
be
it's
moderated,
digestion. Now, one more thing, Dr. Nakul. It was said in the old days that worms, when I was studying, pediatrics means everybody was dewormed.
Deworm.
Coming to GMC. I don't know.
We also, yeah, I
Your
make it a
time-
practice to deworm also if there
because
is
the
iron
worms
deficiency.
also cause
Cause
anemias.
anemia.
Yeah, in the olden days, since
Yeah.
you referred to
Yeah,
that,
yeah.
they would give us an opening dose every year. Endale or castor oil or castor oil.
तो सब लोग उगड़ा सा. He remembers all
And
these.
every year,
Yeah.
my grandmother,
Yeah.
grandfather, this cleaning is important, man. आप दो तोर कोता ही थे.
हाथ कौन नहीं.
हाथ
You know,
कौन
castor.
Yeah.
It was very horrible to have
Yeah.
below the age of 10. And it was, as Senior Jovito said, it was like a ritual.
Okay.
Starting of the
But
school.
it's a good practice.
It's a good practice.
To cleanse
It
your whole
cleanses the-
system.
Yeah, it's a good practice to cleanse. I'm not sure of. I have never
Now,
had.
no,
castor
nowadays
also.
they
Okay.
say that you should not give. They say nowadays. We followed. So, not in children, but they say. We won't go in those details.
But overall, to improve the richness of blood
Yeah.
in terms of RBC, WBC,
Yeah.
what should be a
no,
good
besides
diet?
the nutrition,
Or anything else.
micronutrients, selenium.
Selenium is there. Pyridoxine is one
Pyridox,
of the
B6.
important thing, B6.
Yeah.
Then there is also magnesium,
Magnesium.
calcium.
Yes. Very correct.
So, but all this is
Selenium.
available basically in the food.
Fruit, foods is available.
Yeah.
If you go to see fish and all are rich in calcium,
Fish,
they are rich
yeah.
in
Yes,
magnesium
yes.
also.
Yeah. Now,
Chicken
fish
is also there.
Dr. Nakul, fish also in Goa, fish is considered like vegetarian.
Yeah.
In Goa, like in West Bengal also. Bengal
I
also.
know.
But there may be some who may. And fish which is good is a small fish.
Small fishes.
Like
Yes, sir.
talle, bangde,
Value.
small.
But barik.
Barik.
Moteno.
No, motini, lan.
But in Goa now, the tendency is big fish,
No.
which is loaded with mercury.
Mercury. And so these small fish are from the river. Talle, bangde, then, small fish, modosho. Because these have got lot of omega-3 fatty acids.
Correct.
And they are not only helpful for your build-up of your blood, but also helpful to prevent high cholesterol.
And good for heart.
Good for the heart, stroke, everything, all lifestyle. So this is our nutrition and our worms. I think, as you said, in older patients, if there is anemia, one should think of cancer also.
Yes, sir.
Yes, you have to rule out cancer. Suddenly, if the anemia, hemoglobin falls down,
Yeah.
you should rule out cancer of the, can be stomach. Ulcer, you said, cancer also.
Okay. So when there is anemia in elderly patients, now the thing is, there is one thing which I have observed over last 4-5 years. that once we say what we are reading in the books, so and so cancer is common at age of 60 or 65, but in India we are looking at it much younger age.
Much younger.
The like for example CML, which was supposed to
Correct.
happen at 60 or 65 years of age, I have seen 45-year-olds coming
Correct.
with CMLs.
You're absolutely correct, Dr. Nakul.
What could be the reason?
We are not very sure the
No,
reason
see-
of early onset.
See,
Yeah.
I'll, 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 I'll,
Lifestyle
I'll
is
just
one.
interrupt you.
Lifestyle, basically.
Yeah. See, because of the change in our lifestyle, not only cancers, but lifestyle disease, heart attack,
Heart
MI,
attack, diabetes.
stroke, diabetes, dementia are occurring in a
Early.
younger age, as you rightly said.
Correct.
So everything is occurring because of the changes in lifestyle.
Lifestyle.
And not only that, not only in Goa, other parts of India, other parts of the world also, this because of the changes in lifestyle.
In lifestyle.
Right. So
But-
that is one more thing. So besides this anemia, some patients have chronic anemia. Chronic. They have a liver disease, or they have a kidney disease, or they have a collagen disease, rheumatoid
Correct,
arthritis,
rheumatoid.
which lasts for a long time. So you get a chronic anemia in that. You also must be seeing such cases to you.
Yes.
How are they doing? How do
They are doing good. The one thing about chronic anemias, they are sort of compensated. When I say
They're
compensated
stabilized.
means
They get
when
used
it is
to.
they get used to. Like
Used
when
to.
it was 12, the normal hemoglobin 13, it becomes 12 over a period of time.
Time.
They get accustomed to
Accustomed.
12, then they get
Adapted.
accustomed to 11, 10, 8,
They are
9.
adapted over time.
Yeah, they are adapted over time to hemoglobin of 8, 9.
Correct.
So they are not very symptomatic.
Yeah.
But the trick is to correct the underlying cause.
Cause.
If it is liver disease, kidney disease,
Kidney
or
disease.
rheumatoid,
Rheumatoid.
disease,
Now, collagen diseases are quite common.
very common. Yes, sir.
Collagen disease, rheumatoid arthritis, SLE, they have become quite common because of the change in the immune profile
Immune
of the
profiles.
people.
So would you advise that your blood test, common this thing,
Yeah.
how often you think it should be done?
So one thing, if we keep aside the symptoms, when there is symptoms like generalized weakness, fatigue,
Yeah.
or there is reduction in stamina, or your daily activity, daily work,
You're
you're
getting
feeling
tired.
that I'm not able to do the same with same intensity that I was able to do
Earlier.
previous year.
Before,
Yes.
yeah.
Then we need to first meet a doctor and get them checked. It can be
But
hemoglobin,
even
but can be
otherwise, I would ask Dr. Nakul, you are okay, but how do you ascertain that?
He's asking you with respect to, health checkup.
health checkups.
Yes.
That's what.
Beyond 40, if we go strictly by guidelines and by medical literature,
Yeah.
beyond 40 we have to have a health checkup of CBC, liver tests, lipid profile, that is
Correct.
cholesterol levels,
Correct.
thyroids and all that.
Correct.
At least once a year.
Yeah.
Once a year.
Once a
Yeah,
year.
once
after
a-
40.
Yeah.
After
But
40.
normally, unless you are sick, you don't
Sick,
feel
you don't-
well.
we don't-
Like
No,
you
see,
said.
As you said, Dr. Nakul,
Yeah.
after 40. But today what happens, no? A boy or a girl, she joins a college. Sometimes they check some of these values.
Correct. Yes,
Or the person joins a job.
job.
Job may be in Goa, maybe in India, maybe on the ship, maybe abroad. They have to do a full checkup.
Blood check.
Yes.
So it is done at a younger age.
Younger
so you
age,
have the reports which should be kept to compare. And as he rightly said, after 40, once a
We
year,
can always
not only a blood test but a ECG. Maybe.
ECG and one echo if
E-
it
yeah,
is
if-
if you
if-
have a family history of
Family
heart disease.
history.
All
When you
the-
have a family history of any disease, according to me, the screening should be slightly earlier.
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 If you do regular screening, even for sports today,
Sports,
it
yeah.
is recommended that
Yeah.
when you join a sport,
Sport.
that you do
Do a
certain
full
tests,
checkup.
including the
See,
what we have
Dr.
discussed.
Nakul, nowadays, I was a professor of pathology.
Yes, sir.
Many people are getting a heart attack at a younger age.
Younger age.
So they should be falling down on the fields, playing fields, because it's very strenuous today. The sports is very
Sports.
fast, strenuous. So you have to check these people before
Yes.
they join these teams or do these
Heavy
sports.
physical works.
Huh? Yeah, do a medical.
Dr. Nakul, it is seen, correct me, I may be wrong, that people with blood cancer especially, they go at stage 3, 4, which is at advance. But could you share with us what are the warning signs of blood cancer as you rightly pointed out, some of them.
So blood, when I say about blood cancers, there are three main types which we look about: leukemia, lymphoma and myelomas,
Myeloma.
in a broad umbrella,
Depending on the cells.
depending on the what cells are involved in the
Involved.
body. Now lymphomas can come with some swelling in the lymph nodes.
Lymph nodes. Yeah.
गुटात म्हणतात ती सुजताय.
Well,
Then there can be something called as B symptom. When I say B symptom, it is reduction in appetite, not feeling like eating, weight loss, evening time fevers, night time sweatings. In spite of not having, not so hot, still they keep on sweating so much so that even the bed sheets become wet at
is
night.
it?
So that type of night sweats, fevers,
Loss
and
of weight.
loss of weight,
Hmm.
loss of weight, loss of appetite.
They call
all
B
that.
because A is absence.
Absence.
So B is the presence of these
Presence
symptoms.
of these symptoms.
These symptoms. So continue, doctor.
So these all are one of the symptoms. When we say about leukemias, leukemias are much more graver or dangerous types when they are acute leukemias. Acute means something that comes suddenly. So they come with reduction in platelet counts also. So there might be bleeding gums, spots of bleeding on the body. And when there is reduction in WBC count, they come with infections, fevers. Or if there is very high WBC count sometimes, then they come with breathlessness or confusion, headache, giddiness, all that can happen. Myeloma has a different type of treatment or presentation itself. They come with anemias, but they come with back pains, bony pains, fatigue. So majorly, if you go to see, it is affection in your daily lifestyle is the first warning sign.
So
And
one should take care.
One
Just not dismiss. Na,
Yeah.
नहीं जाता,
See,
बहुत जाता हो. That
Should
attitude
now-
should not
yeah.
be there.
They should go to a physician. Physician should also refer to a hematologist because now we have hematologist in Goa. Dr. Nakul is there,
Yeah, yeah.
Tikare, and Dr. Swami, Madhav
So,
Swami.
Madhav
Plus,
Swami.
I think some others also come
Come and
on
go.
from Bombay or Pune.
They
You know, I used to
come.
bring from Bombay and Pune hematologists to Goa to teach because to teach our students because that time we didn't have.
Correct.
I used to bring Dr. M.B. Agarwal and Dr. Vijay Ramana,
Vijay Ramana.
which you have studied a lot from their seminars.
But today we have
So today
experts and
we have
super
in-house,
specialists.
in-house super specialists
Yeah.
in hematology.
Yeah.
Madhav Swami, Dr. Madhav
Nakul,
Swami, and
Dr.
Dr. Nakul Tikare.
Yeah.
So we are today blessed, and it's good that you have come to serve back your alma mater and your, your state.
State.
Yes. Just to add,
Yeah.
he's Dr. Tikare.
Yeah.
There was, as I joined MBBS, 77, in those years, 70, there was one Dr. Tikare who was Associate Professor of Medicine
Medicine.
in Ribandar. I know you don't know him because maybe same surname, same place, Dharwar. So he was also very bright, I was told, though I never met
Yeah.
him.
Yeah.
I think he migrated to Canada or
Canada,
something
yes,
like
sir.
that I heard. So anyway, it is good that Dr. Tikare has come. So WBC, leukemias we discussed, lymphomas and myeloma. Now, when WBC counts are high, no, chronic leukemia also, if you can tell.
Chronic leukemias are something, when we say leukemia, it is a high increase in WBC count. Chronic means over a longer period of time.
Slow.
So the symptoms are not so grave sometimes. So chronic leukemias can have some increase in something called as spleen size in the stomach.
Correct.
So it presses on the stomach and then you have reduction in appetite, early
Fullness,
satiety,
fullness.
fullness. On eating little amount of food also you feel food. All that is there. And most of the times in the West it is detected by routine testing.
Routine.
Now, if we incorporate that same concept in India, I think we will be able to.
So that
all
routine testing, how routine it is?
There is no particular way or this thing, but I would suggest once a year
Doing
a blood test is more than
to do all the blood tests.
Yes, sir.
Once a year is enough.
Once a year.
Yeah.
And especially
If
after,
you have no symptom. If you have symptoms, immediately.
Yeah, if you have symptoms, immediately.
Yeah.
But for a normal, regular person, routine tests are also a must.
Yeah, a must.
Because normally they say,
No. And Dr. Nakul, also if there's a family history, then you have to be cautious and careful. And these are three things.
Family history is one of the biggest warnings.
It's very important. Very important.
But you acquire all those, also problems,
problems
from
yes,
your
yes.
parents.
From genes.
Yeah,
Yes.
fine.
So that was about leukemias. So chronic we have CML and CLL,
CLL.
and they last for some time.
The last one.
Okay. Now coming to the other anemias which we see in children, hemolytic anemias, thalassemia. So a few things about that.
So hemolytic
In children?
thalassemia is something that is a genetic defect of
Yes.
production of hemoglobin.
Yeah.
So it is, I believe it can be actually eradicated if the parents are screened during the planning for the children time.
Screened and
for
counseled.
for the same.
Yeah.
Because if they are largely asymptomatic, they don't have any symptoms.
They're carriers.
They are just carriers. So once there is a kid from two carriers, there is a 25% chance that the kid might be thalassemia major, and that is something that is very difficult. It's a lifelong diagnosis that you are tagging a
It's
patient.
very sad and lifelong.
And it is completely preventable by just screening the parents when there is planning of pregnancy in the initial stage. So that is more than enough. Even if they have conceived or the lady is pregnant, there are tests by
Genetic
ultrasound
tests,
there where we can detect the genetic test and all that things can
So,
be
but
done.
then this has to be done pre-nuptial. Pre-nuptial.
Preconception.
Preconception.
Yeah. But because this sometimes is seen later on when it is too late, and then there's a conflict.
Yeah,
Conflict.
this is a
Yes,
conflict. Correct. So this is thalassemia, and then they need
And
transfusion.
They need transfusion. The
Every-
only treatment for
Yes.
them is early counseling and bone marrow transplant.
Bone marrow
That is one
transplant.
of the treatments for
Treatment.
the thalassemia. There is treatment with gene therapy coming up, but not quite in India and extremely expensive as of now.
So this is one thing, thalassemia. Sickle
then-
cell is not common in Goa.
Goa, yes, sir.
Followed. No? It is common in Africa. But I tell you that we see sickle cell, and you'll be seeing it, to patients who come from other states, who come to India, who come to Goa. They come for work. No? From other states, usually tribal areas, they are common.
Yes, sir.
Sickle cell. And in Goa, sickle cell has come from the slaves. Slaves were being brought to Goa. I don't know if you know. During the Portuguese days, African slaves. And then they moved out of Goa and went in near Belgaum. That is, they are called Siddhis.
Many of them are there in Gujarat.
Gujarat, yes.
Yeah.
So these all they were brought by they are African slaves.
Yes.
So they moved. So they carry the gene.
They carry the
sickle cell gene, and thalassemia gene is carried. Thal is the big sea, Mediterranean Sea.
Mediterranean
So
Sea.
Alexander, who came, he has
When he
the
came
Greeks
across,
brought the, when they invaded, they brought the gene. So that is the story of. So the genetic today will tell you the story. Genetic.
Yes.
And then bleeding disorders. Do you see a lot, Dr. Nakul?
Bleeding disorder, I would like to say that there are two types, inherited and some acquired from some other thing.
Yeah.
Acquired means because of infection, because of some medicines. Some
Correct.
medicines has a side effect, some drug abuse in some youths. All those can have these bleeding disorders. When we say inherited, that is generation to generation, which is transmitted. Hemophilia is very common, but not as common in Goa. But still, it is one of the significant diseases. We have a hemophilia society.
We have a hemophilia society. I think about 100
100 or
70 to 100.
But few, not.
And now there's good treatment. The new molecule is come.
New molecule is
Yeah,
come.
Novo
It's called
7.
as emicizumab.
Yeah, emicizumab.
Emicizumab.
Before that, Novo 7
Novo
was given.
7
Now
was there.
emicizumab, which is a wonder drug molecule.
Correct, sir.
Wonder drug molecule.
So,
And Doctor in JMC, Dr. Neorekar looks after Prasad Neorekar. So Dr. Ramnath Neorekar. So Dr. Ramnath Neorekar, a team comes from Bombay and they have trained,
correct.
brought by the Hemophilia Society, so that these patients now they have made a dedicated ward. So they have to take many times transfusion when they get hit,
Yes, sir.
or so they go directly. They don't have to go to the casualty. Where time is wasted. So there's a very dedicated treatment for these people.
Correct.
One media person, Prakash Kamath, he used to come and have lot of
Okay,
camps.
okay.
I think he is the president of the Porvorim branch.
Hemophilia Society.
And he has done very good work. I have to appreciate all that group. They used to come to me to have the camps for antibodies. Now with this,
Emicizumab.
emicizumab is a molecule.
You don't
acts
require factor 8 concentrates to be given.
To be given.
Plus, major advantage of that molecule is it is given as a skin injection.
Skin injection.
Okay,
So we don't have to put a line and
Line,
give an
yeah,
intravenous
yeah.
injections.
He
every
told
time.
me like this. 2-3 patients were saved, operations were done, etc. It's like a wonder drug.
It is definitely a
Wonder
very
drug.
good thing that is
Wonder
done.
Dr. Wiseman and
Some-
Dr. Nakul, very often doctors advise that you have a look at your stools.
Yeah.
And if there is blood,
Yeah.
you,
Correct.
yeah.
So Nakul,
So, blood in stools is like again as per age group. If it is a kid who is having a blood in stool, we have to rule out worms. That is one of the common things. But if it is an adult or an elderly, especially beyond 40, 50s now, blood in stool, we have to meet a gastroenterologist.
correct.
We have to do
But
some
it could be
testing.
cancer.
It could
Now-
be cancer.
yeah.
That is the first thing on our mind which we
Mind,
need to
yeah.
rule out.
Yeah.
So see, Dr. Nakul, so the blood may be fresh blood or maybe tarry colored,
Tarry colored.
dark
Yes,
colored. Both are blood. Tarry colored is coming from upper GI tract.
Upper GI.
And fresh blood from the lower.
Lower.
So they have to meet. First, you have to do your blood test and have to meet a gastroenterologist
Gastroenterologist.
to do the endoscopy,
Endoscopies.
etc.
Yeah, and also blood in urine, the
Hematuria.
hematuria.
Blood in urine.
Yeah.
Blood in urine, most commonly, if it is painful, then it is because of a kidney stone.
Stone.
Okay.
Stone.
If it is painless, then we need to again evaluate if there is any kidney disease or a kidney problem. Sometimes some people have those cysts in the kidneys which rupture and then there is blood in the urine.
Because this has been seen in many footballers of late.
Hematuria.
Yeah, hematuria.
Yes.
And the latest interventions are there today.
I know.
Yeah, they,
See, nowadays, there are so many types of anemias and blood disorders. Now, I will give you one example. It is not very common, but he is into sports. He's an expert in sports last 50 years. You know, I don't know how many cases you have seen. They say there's something called as March hemoglobinuria. After they run on a hard surface, there is trauma to the red blood cell.
Red blood
And
cells.
then they pass urine in the stool.
is it?
In the urine.
Urine.
It's called March hemoglobinuria. Like people marching, running on hard surfaces, or judo and
Yeah.
The marching creates a little bit of damage to the
Friction.
blood.
yeah.
And
Okay.
The
those
cells.
damaged bloods are tried to remove out of
To
the
remove
body as a
it.
natural mechanism because they are damaged.
I don't know. Can I soil to get player?
No. This is the first time.
No.
that,
You know why? Today the shoes which are coming are perfect.
Perfect.
Nike and Adidas, they ran this within less than 2 hours. So that's another anemia. So now also we see a lot of autoimmune hemolytic anemia.
Autoimmune hemolytic anemia. Now, autoimmune hemolytic anemia means it is basically the blood that is produced is broken down
Yeah, your own.
abnormally. Our own blood is broken down by our body,
Yeah,
thinking it as something harmful. So
Okay.
it is a immune dysregulation. Our own immunity misidentifies the blood cells and tries to break them off. Now that can be a part of a larger disease like SLE, rheumatic disorders, where or immune mediated disorders can cause this anemia, or just plain anemia.
Yeah, plain. Just for the knowledge of the public. Now the last thing, lot of MDS. It's like a pre-leukemic state, myelodysplastic syndrome. Let Dr.
Yeah,
Nakul
yeah.
talk about. In short, MDS.
MDS is something that is now seen in elderly age groups. Lots and lots of people who are coming with anemias. It is basically a production defect of the hemoglobin or WBC or platelets in the bone marrow. The shape is not good and they are not produced in a efficient manner. So the levels come low. Hemoglobin, platelets or WBC levels come very low. And the treatment is some other therapies are there. But it mainly depends now we have to do some, there comes the importance of something called a bone marrow testing. So all these are produced in the bone marrow. So we have to put a needle in the bone marrow, take out some blood and send it for testing, and that is where how we diagnose MDS. Plus now with more and more targeted therapies, there are lots of mutations that happen in MDS. Very important to detect what are the mutations. They give us information. One is regarding how good the medicines respond in those mutations. One is how bad the mutation is. There are some mutations which are really bad, where in spite of our best efforts, unfortunately, they don't work, the medicines. So like
So these are-
TP53 mutation.
yeah.
So they are very bad.
P53.
In spite of doing everything, they come very
Yeah.
this thing. Somewhere we require transplants
Yeah.
to be done.
Now, today we will not talk of bone marrow transplant. That we will be
Yeah,
done
some other time.
Some other
Yeah.
So I think we'll ask him, what is your message to the people of
Yes.
Goa regarding hematology diseases? I know that they have to come to a hematologist. Now the people of Goa should know there are hematologists. Otherwise, it is to be treated by a general physician.
Yes. yes.
So now we have super specialists.
Yeah,
Dr.
that
Nakul,
also,
yeah.
Dr. Nakul, blood disorders today can be cancerous and can be also non-cancerous.
Non-cancerous,
Yeah. Oh,
So
Non-cancerous
Sir
are all
has
these
summed
like
up
anemia,
everything.
which are very common.
yeah.
So we have our first step is to first see whether it is cancerous or non-cancerous,
Non-cancerous.
because time is the main thing over
Correct.
there.
Yeah.
And main thing, like once we come with anemia, we have to treat in the optimal way. Like it's not about treating the hemoglobin; it is also about treating the storage part. Iron
Correct.
deficiency, we have given iron, hemoglobin comes on top. That is not the end of it. We have to continue giving iron for a particular time period so
The
that
stores
body stores are also filled up.
depleted.
So that is where it is very important. And treating the cause.
Correct.
Anything what has come up, there is always a cause for it. Anemia, why there is anemia? We have to find out the cause and then treat that. Just treating anemia is like fever and
Yeah.
crocin. We are not finding
Yeah.
the cause of fever.
So for the general public, if they feel weak, fatigue, weakness, breathlessness, they're not able to do their walk, exercise, or their walk, they can't climb up. And if there are some infections,
Then
or if there is some sort of bleeding,
bleeding spots.
go to the doctor. The doctor will order your blood test.
And
Today we have got very good auto analysis, means cell counters,
Cell counters.
which are
yes,
like
sir.
9 part, etc., which give you.
Everything.
First it was only 3. First
Three
it was
parts.
manual, then it became 3 part, then it became 5 part,
part.
and now it has become 9 part,
9 parts.
which gives even parasites, gives you
Everything. is there.
ESR, gives you these. All it is advancing. Nakul, you joined MBBS now. In 86, when I answered MD Pathology of Bombay University, MDS was a question first time, means it's come first time. Described first time in the world, 1986. A question was asked in hematology, in Bombay University. I'm a product, like MDS. Of course, I'm lucky that I'd read it in detail and. So the types of MDS and all that, pre-leukemia. Now today it is, so much of research is done from 86 till today that there are books on MDS.
Correct. Yes.
Yeah. Now Dr. Nakul always had a desire to join hematology. When I used to bring the Dr. Vijay Raman and Dr. M.B. Agarwal, he was always asking them lot of questions one to one. And I remember him asking Vijay Ramanan as he entered into his car, after our lecture in the library auditorium, what books to read to crack the Vellore exam. Right or wrong?
Exam. Yes.
CMC Vellore exam. How many years back that was?
That was in 2018.
18. So very long back. So a good thing is that we had a visiting faculty program which was started by us, by me. And we used to get people whom we didn't have. Now we are having them here.
Yeah.
So it is good for our students to learn from Dr. Nakul Tikare and Dr. Mahadev Swami.
Yes.
Hematology.
Yes.
Which will be, and they are also doing bone marrow transplant. That was.
Any final message?
Any final, yeah.
Final message, if there is low hemoglobin or platelets or WBC count, we have to just find why it is happening. That is one thing. But never ignore one of the most important symptoms, that is weight loss.
Weight loss.
Weight loss is
Unexplained
something
weight
unexplained
loss.
weight loss. Yes, sir.
Some people are
Intentional weight
exercising,
loss.
dieting, and doing all sorts of activities.
So
Unexplained
weight loss
Correct.
is a big red flag.
Big
And
red
that,
flag.
That with a hemoglobin being low,
Low.
always we have to rule out
You
the
have to rule
worst
out, yeah.
first.
So I think we have covered
Dr. Nakul, thank you.
everything, and the most important
Muito
one.
obrigado.
Thank you very much, Dr. Nakul and
Nakul,
Dr. Wiseman.
Senior Jovito
Yeah, and
Dr.
if there is any progress
Yeah.
in your field, I am sure you will share with
Yeah,
us
sure.
and
Thank
with
you.
all our viewers.
Obrigado.
Thank you very
Thank
much,
you.
Dr.
Dev
Nakul,
Barankar.
and thank you very much, Dr. Wiseman.